We'll move now into the session on Alzheimer's disease and aging. We'll start with the secondary molecular mechanisms. Okay, so Jenny Libien and Yvonne Hernandez. Want to bring that up?
Yes. You need the remote.
We're going to try to do 25%, 75%. So I have more slides, but I'm a pathologist, so I have slides. And we changed the title to be The Nucleolus in Memory and Alzheimer's Disease.
That's that way.
So Alzheimer's disease is the most common type of dementia, and it is very common, and its prevalence increases with age, so that about a third of all people over age 85 and over have Alzheimer's disease. Alzheimer's disease neuropathology is also very common in post-mortem examinations of older individuals, and about half of all older individuals have Alzheimer's disease neuropathology. And the hallmarks of Alzheimer's disease neuropathology are shown in the slide, which actually I screen captured from one of the virtual slides we use for medical school teaching. And we have neuritic plaques that are made up of beta amyloid and tau, neurofibrillary tangles within neurons that are made up of hyperphosphorylated tau, gliosis, and neuronal loss. And as a neuropathologist, my role is to determine the level of AD neuropathologic change. So that would be the diagnosis I would give. And this is done by assessing the frequency and the distribution of those plaques and tangles, and scoring the likelihood that the AD neuropathologic change would be sufficient explanation for the dementia. And that score would be not low, intermediate, or high, and if it's an intermediate or high score, that would be sufficient for the AD neuropathologic change causing the dementia. And that's a lot of words, right? And why are we so careful and use so many words to describe this? And that's because we've recognized for over 30 years that there are people that have AD neuropathologic change but do not have dementia. And one of the most important earliest papers came from Howard Crystal, who most of the people in this room know. And so those non-demented subjects with Alzheimer pathology but intact memory, he called it preclinical AD. And that's one term, and another term would be to call it asymptomatic AD, or Alzheimer's disease. And so now it's pretty widely accepted that Alzheimer's disease exists on a whole continuum. And some people do not move through this clinical continuum, and some people do, and the rate of progress through it varies from individual to individual. So that brought us to some really pretty big questions about why are some people vulnerable and some people resistant, show resilience. Why is there this cognitive reserve? So we asked, still very big question, what contributes to memory loss in Alzheimer's disease, and what contributes to resilience in the presence of AD pathology? Why are some people asymptomatic? And we decided to look at a memory molecule, not PKM zeta in this instance, but PARP1. And PARP1 is important for memory formation. It has multiple functions. As Jim Knowles told us, important things have to do multiple things. So PARP1, one of its functions is to regulate the biosynthesis of new ribosomes, which are important for protein synthesis so new memories can form. And so what we did was we looked at PARP1 expression in the hippocampus of individuals who had no neurologic disease at time of death, and in individuals who died with a diagnosis of Alzheimer's disease and had significant Alzheimer neuropathology. And what we found in the control individuals was that there's this distinct staining of the nucleolus by PARP1, and that you can kind of see these very sharp borders, and then a loss of that distinct staining, a more diffuse staining in Alzheimer's disease. And we did various types of quantification of that. And so we also looked at other nucleolar markers, and we saw that it's not just PARP1, but there's a change in the nucleolus with Alzheimer's disease. And this has been described by some others too. And so we came up with a hypothesis that nucleolar health might be the determination of whether there's vulnerability or resilience. So as there's an AD progression, there's nucleolar stress and there's a smaller nucleolus. And then our question is whether nucleolar hypertrophy could be responsible for the resilience that some individuals show. And that would be why there's asymptomatic AD. I'm going to turn it over to Yvonne Hernandez.
So I want you to really think in what she said about vulnerability, having a nucleolus that is very small, right, unhealthy, or to have a big nucleolus, maybe even bigger than regular neurons. And that's the feature of asymptomatic Alzheimer's disease cases. Now, how can we start studying the role of the nucleolus in learning and memory? Well, what we did is to take advantage of a drug that is a blocker of RNA polymerase 1. RNA polymerase 1 is the main polymerase working in the nucleolus, is in charge of transcribing ribosomal RNAs. And if you block that synthesis, you block pretty much the function of the nucleolus. So we try to mimic what happened in Alzheimer's disease. So we kind of shut down the nucleolus. And we tested in behavior the active place avoidance that Andre has shown before. So we inject the drug, then we do habituation and training of the animals, and then we do a retention test, which is going to tell us whether memory is really working well. So this is what happened. With or without the drug, the animals during the training trial, they are avoiding the shock area. But when we come back the next day, if we compare the animals that were treated with inhibitor of RNA-41, they actually don't remember anything. So this is saying that the nucleolus, if we shut it down, even transiently, is going to have consequences in the memory consolidation. So can we do the opposite? That's the other question. So can we take a normal cell, try to make hypertrophy like the asymptomatic Alzheimer's disease case, and get a super good memory? Well, we're trying to do that by taking advantage of an activator of the mTOR pathway, because the mTOR pathway is the main activator of biogenesis of ribosomes in the nucleolus. So what we did in this case is train the animals. We didn't do 3 training trials, but rather 2, because we don't want the animals to learn well, because we want to see if we can produce memory enhancement. And this is the control. We have the training trials. The animals are avoiding and learning at the same time the shock zone. You can see here, this is the shock zone. But if you come back next day, because they are not trained well, they kind of get into the shock zone. Okay? They have some sort of idea that, because they are spending more time at 6 o'clock of the shock zone. But when we measure, the animals were treated with the drug, the video activator. This is what happened. So we were able, in this particular case, with the idea, of enhancing what the nucleolus does, memory enhancement. Okay, thank you. So, the take-home message, okay, it is the nucleolus matter. If you have a nucleolus that is unhealthy, or if you shut down the function of the nucleolus, you're not going to have memory consolidation. But if you enhance the activity of the nucleolus, you can enhance memory. These are the collaborators that we have, and thank you so much for